thank you so much for taking time out of your day. And I know, I mean, I'd give this to an empty chair. This information's so vital because I'm on the net. Now, I always look at the different subjects that are coming up that we're talking about. And when you go on, YouTube is the second largest search engine. So if you go onto YouTube and type in fibromyalgia, you're going to get these doctors with incredible connections to different universities, great credentials. I mean, guys that you'd think would know a lot, okay, about this. And what was frustrating with me is I'm looking at these, head of the rheumatology department, head of all of these different departments. They're all saying the same thing. And what they're saying doesn't make sense. Then I'm looking at different snippets from talk shows, and people are saying, "Oh, it's real, even though there's no blood test for it." And other people are saying, "Thank goodness I'm validated now. I really do have this disease." The symptoms are real. Okay, they absolutely are. What's frustrating is, from a medical standpoint, they can't be treated with toxic chemicals. I mean, and that's it. When you go to the Mayo Clinic, and I know this is wordy, boil it down. A disorder characterized by widespread pain, fatigue, sleep, memory problems, amplified by painful sensations. Symptoms, now look at this. Okay, this is on the Mayo Clinic. Mayo Clinic's supposed to be world famous, right? They're supposed to know what's going on. So like if we were back in the 1300s, we'd want to go to the head of geography that would explain the world is a flat disk and there's sea monsters beyond so much. And the knowledge of the time, and that's what we're looking at. It begins after a physical trauma, surgery, infection. So it begins after a trauma, physical, chemical, or emotional stress. Your body doesn't know the difference from this. So it begins after a trauma. It begins after a trauma. It begins after a what? Trauma. Okay, so now, since your body doesn't know the difference between physical, chemical, or emotional stress, let's look for the source of the trauma, not deal with the symptoms. Okay, does that make more sense? That's not what the Mayo Clinic says. Well, there's no cure. There's no cure. What does the Mayo Clinic say? No cure. No cure, because they're doing the wrong thing. They're trying to deal with the symptoms. That's foolish. It's like trying to correct high blood pressure with a blood pressure drug, or high cholesterol with a cholesterol drug, or indigestion with an antacid. None of those things fix an underlying mechanism. So it begins after a trauma, and there's no cure if you treat it with chemicals. I'm in total agreement. So far, we've had 100% success cure rate with it. 100% success cure rate with it. Okay? And I've got to repeat this because people are suffering because they're listening to the experts. It's like Galileo would look through this telescope and say, "No, you guys got it wrong. We spin around the sun. All you got to do is look through the scope." "No, we're not going to look through that. The blasphemer." This is the facts if you're going to look on the net for fibromyalgia. This is the facts if you talk to the head rheumatologist. These are the facts that you're going to go. Chronic pain syndrome, they hurt all over. No kidding. After a trauma, I would too. Okay, if I had a splinter in my arm, would I hurt? Yeah. Could you give me drugs to make this not hurt? No. Yes, you could. You couldn't give me enough morphine to help me with my splinter? Yeah, I'm not saying take the splinter out, but could you give me enough drugs to not feel it? I could have a broken leg. Could you give me enough morphine where I could go running? I might fall down. I mean, my arm might get infected. You may have to amputate it, but could you give me enough drugs to be comfortable while having a splinter? I know, so that's a foolish approach. Tenderness for at least 3 months. After a trauma, if you don't get the problem fixed, are you still going to be hurting? Absolutely. 93% received medications. And you know what happened to the other 7%? They couldn't afford it. Because that's the only solution that's being offered. There's no intelligent approach to fibromyalgia. And so this is ignorant thinking. This is 19th century thinking. See, what they did is they broke the body up into different parts. If you have joint pain, you go to the rheumatologist. If you have depression, you go to the psychiatrist. If you have a gastrointestinal infection, you go to the gastroenterologist. Now, does the gastroenterologist, the absolute expert of diseases of the digestive tract, does he ever take nutrition? No. Now, if I was to tell you that over 90% of the body's serotonin, which is a hormone for the brain, a feel-good hormone for the brain, that if you have appropriate serotonin levels, that you're not depressed and you're able to adapt to environmental stressors, that's produced in the gut. Is the psychiatrist aware that serotonin is produced in the gut? No. So when you look at this, the dermatologist, knowing that the skin is the largest organ of the body, and if your body can't detox, the skin's going to express this in rashes, in toxic, it's trying to get that exudates out of your body. Is chickenpox a skin disease or a systemic problem with toxins that your body's trying to get rid of? Systemic. So you look at this, it's absolutely ignorant to divide this up into different problems. And that's what the people who are suffering from fibromyalgia are going through. They're suffering this, and they've gone to every doctor. Why? Because the doctors don't understand the entire system. They're experts in disease. If I told you that I want to be a financial investor, and I've studied poor people my entire life, I've studied everybody in Watts, are you going to invest your money with me? No, because I know poor people. If I've studied disease, are you going to go to these guys to promote health? No, it's a broken system. So then I start looking into this, and I think a lot of doctors are saying, well, we're sicker because we're just living longer. Okay? And I start looking at this, and I think, are we? Because I'm a big history buff. I like American history. I like the idea of going against the imperial authorities that are doing things that are against us. And I remember Franklin died at 84. Okay, and we're talking Thomas Jefferson died at 83. John Adams died at 90. Now were these guys in the last 10 years drugged out in a rest home? No, they're vital. Oh my gosh, I think Franklin had a couple of girlfriends in it when he was 80. But when you look, I mean, of course, George Washington died at 67, but he died from medical care. We know this. He was bled, which was a common medical procedure, okay, for I think it was a cold. And I think that according to the records, he lost about 1 liter of blood. But he had the expert, you know, the absolute expert of the time working on him. So when we look at this, they've changed the rules. We are not living longer. Human life expectancy has not changed in about 2,000 years if you factor out infant mortality. So let's say you were born, you just had birth in 1900. Okay, you just gave birth to 2 boys. One boy died at birth, the other one lived to 90 years old. So what was the average age of your children? 45. Okay. But when you look at this and you look at people that have survived, okay, over 21, 30 years old, around there, okay, what was their average lifespan in 1900? It was 77 years old. What was the average lifespan of somebody now? 78. What was Ramesses? Okay, we're talking Pharaoh of Egypt. He died of a tooth infection in his 90s. Okay, so we have to start looking at this. We are not living longer if you factor out infant mortality rate. So it's not true. Now, this planet has certain biologic laws. Okay, and this, I want you to start understanding this. There's certain biologic laws of every species on this planet that you are not taught. Is the human being a species that lives on this planet? Yes or yes? Yes, we are. Okay? So we've been on this planet, records show, about 40,000 years in this form. Okay? So we've been on this planet a long time. Do we have to abide within the laws? Yes or yes? Mm-hmm. So now the lifespan hasn't changed in a couple thousand years. We have to abide to certain laws. Now, the laws of the species on this planet, each successive generation has to get stronger. Because if each successive generation got weaker, what would happen to the species? They wouldn't be here. Okay, so that's a biologic law, okay, that we have to get stronger every successive generation. Now, every successive generation can't have a majority of genetic diseases. You know, we're talking maximum 2 to 3%, and that's Down syndrome and things like that. Because if they have a majority of genetic diseases, is that species going to survive? No, they can't. Now, does every species that's on this planet, every species, do they have trouble regulating their own bodily functions? Like, can a bear regulate its own cholesterol? Does a beaver have high blood pressure? Do giraffes have indigestion? Okay, now I'm watching the Animal Planet. Now this is important, okay, because I mean, when I watch TV, I like documentaries. I love information. You know, obviously, there's something mental. So I'm watching the largest animal migration on our planet. 3 million caribou going. Now let's say, just for the heck of it, okay, let's say I'm watching this and they say, oh my gosh, we got a problem. 3 million caribou. Did you know that 30% have diabetes? In fact, 50% have cancer. And of those caribou, the 3 million caribou that are going on the largest animal migration, I mean, virtually 30 to 50%, depending on the color of the caribou, are going to have diabetes, high cholesterol. They're going to have, and 45% are going to have one chronic disease. Okay, this is the herd of caribou going up there. Should we go up? What would you want to do to the caribou? Would you want to give them chemicals to alter their physiology, or would you want to find out why their physiology is altered? Why? No, I'm sorry. No, you're going to treat caribou different than you would humans? What's the difference from the species? Because I'm given statistics of America. 50% of us have cancer. 50% of us are going to have diabetes, depending on the color of your skin. We're talking 45% have a chronic disease. Okay? Would you treat human beings different than the caribou? Why? Are we living longer? No. See, you're living a lie right now. You're violating a biologic law. If you take a chemical to alter physiology, you're violating a biologic law. If you take a drug to change your blood pressure, you're violating a law. Does that make sense? So we got to start changing this, because you're flat earth thinking. Your doctors are flat earth thinking. The people treating fibromyalgia are flat earth thinkers. They're not going to look through the telescope. They're not going to see the truth. The truth is, we're designed to live on this planet, and if you alter physiology without respecting the body, the outcome is disastrous. Now I'm looking at this, okay, and I have several asthmatic kid patients. Well, they're asthmatic when they first see me. It takes about 2 to 3 weeks to get kids over asthma. And the kids always come in and they say, well, you know, if a kid has asthma, even though we have a 100% success rate cure in childhood asthma, that they must get adult strength flu shots. And I'm going, where's the studies for that? So here's a study. And I go and look at it and I go, wait a second. If you give a child with asthma a flu shot, a neurotoxic shot in their body, they have a 300% greater, or threefold greater risk of going to the hospital. So this is adding, okay, a foreign toxic product inside. Because do the caribou need a flu shot to survive the winter? No. So this is a tough concept, I know. Disease doesn't exist. It's the body adapting to environmental circumstances. If you eat fast food every day, is your blood going to be acidic or healthy? Acidic. So the body's going to go in and draw calcium off, so you're going to be misdiagnosed with osteoporosis, when it's just your body trying to draw that calcium off to alkalinize the system. If you have damage to your tissue, your body's going to require more cholesterol in order to produce appropriate hormones to repair the tissue. Does that make more sense? Okay, so if you have more than 1 pound of extra human, there's a mile of blood vessels. Let's say you're not breathing correctly. Okay, in order to keep oxygen and nutrients flowing to the tissue, is the pressure going to have to go up? Yes or yes? Yes, so all of these things, what we call disease, is the body adapting to deficiency or toxicity. So when we start thinking about fibromyalgia, these people had a what? Trauma. Physical, chemical, or emotional trauma. Okay, so they had a trauma, and their body is adapting to it as best they can. The reason there's no cure is because they're using chemicals to try and change the physiology instead of respecting the physiology. The reason we have a 100% success rate curing fibromyalgia is because we don't deal with the muscle spasms. We deal with the underlying problems. We don't deal with the digestive issues by giving a chemical. We heal the digestive problems. Okay, does that make sense? Does darkness exist? Can you measure darkness? I know, you can't. What you can do, I can measure the photons of light that this bulb is emitting. We can measure, light is energy. Darkness is just lack of energy. You can't measure darkness. What does the Bible say about It's because a lot of times at nighttime I'll go outside and just curse the night. Oh no, you can't curse the dark. It's better to light one candle than to curse the darkness. Good, because I cursed the night all night long and it didn't get any lighter until the morning. No, I'm just kidding. So one candle can wipe out any darkness? Yes or yes? Okay, good. I'm with you on that one. So disease doesn't exist. It's just lack of light. So this is what happens in every fibromyalgia patient. You take on stress, physical, chemical, or emotional stress. Your body has a normal response where respiration's decreased. It's a headache and stomach irritation. This is a normal physiologic response. What's abnormal, what's against biologic law, is to take a chemical to alter your physiology. It's against biologic law to take a chemical to alter physiology. Do you understand that? Mm-hmm. The fourth leading cause of death in America is properly prescribed drugs. That's the right drug at the right time, at the right dosage for the right condition. It's the fourth leading cause of death in America. Why? Because it's a violation of biologic law. Okay, so this is huge. Now, when we look at this, posture radically affects the function. And this is one of the first aspects of fibromyalgia patients that we look at. I mean, this is normal. This is abnormal. Do me a favor. Sit up straight. Put your head forward. Okay? Really forward. Round even your shoulders. Now, take a deep breath. Okay, now reposition the head, shoulders. Sit up nice and straight. Take a deep breath. This person is harder to breathe. Yes or yes? With the rounding of the shoulders, is she going to have increased blood pressure in order to keep her brain functioning healthy? Absolutely. And that is normal for her physiology. But what would a violation of biologic law be? Would be giving her a diuretic or beta blocker or a blood pressure drug to decrease the oxygen in her brain. That's the side effect or the effect of blood pressure drugs. Does that sound stupid or stupid? Okay, so what we're looking at, she had some type of trauma. She has deficiency that's choking off her nerve supply. This is absolutely incredible. 90% of the brain's energy is used in posture. This is a typical fibromyalgia patient. And this is her standing up straight. Does she look like she has stress? Absolutely. That's her afterwards. What's tough is getting the patients off of the blood pressure, the antacids, the muscle relaxants, the pain relievers, the antidepressants. Getting them off of each chemical that is a violation of biologic law. You're trying to alter physiology with a chemical. But the body is built by God. It's designed to heal. Health is the natural state. So doctors now, instead of approaching people and say, yes, I believe you have this, even though there's no blood test or x-ray analysis or anything else. By God, respect the people. Don't look for anything, because what they're doing on fibromyalgia patients is and this is when I'm looking at this, they're taking a muscle sample. They're taking a muscle biopsy. They're biopsying the intestinal tract. They're drawing cerebral spinal fluid off. And they're saying it's all negative. No kidding. If you have a subluxation pattern like that, if you have nerve pressure, the muscle biopsy is going to show normal. The cerebral spinal fluid is going to show normal. They're missing the elephant in the room. They had a trauma. Look at the nervous system. What controls muscles? Do muscles jump off? Have you ever had a steak? Does it jump off the plate on its own? No, the nerves control an increased tone of the muscles. What controls digestion? Say the nervous system. What controls digestion? Nervous system. Good. What controls the muscles? Nervous system. I mean, if you look at this, do fibromyalgia people have headaches and depression? Yes. What controls, where does 93% of all headaches come from? The neck. So do they have a neck problem? 100% of the time I've seen. So look at the problem in the room. Disease doesn't exist. Respect the body's processes, because if you take a high blood pressure drug, if you take an antacid, if you take cholesterol drugs, that's a violation of biologic law. This is true a couple hundred years ago. It's true today. Doctors are men who prescribe medicines of which they know little, to cure diseases which they know less, in human beings which they know nothing. If you got a doctor today prescribing a cholesterol drug, which we know the side effect of cholesterol drugs is increased diabetes, we know the side effect of blood pressure drugs is increased heart disease, blood pressure drugs will increase cancer. I mean, you look at this, flu shots increase diabetes rates. We got a population 50% diabetes. This is absolute a violation of biologic what? Law. Tylenol and non-steroidal anti-inflammatories. How many people with fibromyalgia have joint pain or pain anywhere? All of them. That's one of the diagnostic criteria. So do you give them a non-steroidal anti-inflammatory? I wouldn't, because it's a violation of biologic law. Okay, but what's worse is the doctors are prescribing it. It destroys proteoglycan production. That's the building block of cartilage. Yes, ma'am, this will make you feel temporarily better. Yes, ma'am, it will destroy your joint cartilage. So if you take this for enough time, you're going to be in deep trouble. Why? Because you're altering physiology with a chemical that's a violation of biologic law. These rheumatologists got to go out and go back and study anatomy. Do you hear that? Okay? Enough is enough. There is a solution for fibromyalgia. It does not lie in chemicals. Antidepressants, addictive and dangerous. No kidding. So if someone is in pain, let me explain anatomy. And all the doctors watching this, I'm going to explain anatomy to the rheumatologist, because obviously they forgot. If you have pain, blood supply to the gut is shut down. Why? Because it's called a sympathetic dominant pattern. If you shut blood supply down to the gut, guess what happens to serotonin production? It goes down. That means somebody in chronic pain is going to have lack of serotonin production. You don't give them a drug that's addictive and dangerous, that has a side effect of suicide, that's never been tested beyond 13 weeks. That's a violation of biologic law. Heck, that's a violation of common sense. Does that make sense? That's the toughest drug to get off of. So when we look at this is the black box warning on those drugs. It says antidepressants increase the risk compared to placebo of suicidal thinking and behavior. Anybody know what suicidal behavior is? It's called trying to kill oneself. Okay? Which there is more of out there. Why? Because there's more antidepressants being out there. The original Hippocratic Oath. The Hippocratic Oath was changed, by the way. This is the original, and it was changed back in 1964. It no longer says, I will use those dietary regimes which will benefit my patients, because they don't teach them nutrition. Okay, I will not give the lethal drug to anyone if I'm asked or advised. I'm sorry, this one says it's going to increase risk of suicide. If we still use that oath, we wouldn't do it. Serotonin is produced in the gut. The number one way that we start to heal fibromyalgia, to start to reverse fibromyalgia, is we heal the gut. So this means antibiotics. We've got to heal the intestinal tract. We've got to restore the nerve supply to the gut. Because look what happens if you have low serotonin. Sexual desire, sleep problems, social behavior, heart problems, muscle pain, endocrine problems. Oh my gosh, this sounds like fibromyalgia, doesn't it? It does to me too. Leaky gut. This comes from vaccinations, antacids. It actually blows holes in your gut. Okay, now if that does, what other things blow holes in the gut? Medications. Okay, that causes these. And in fact, we know neurotoxins, which is the ones in Gatorade, the MSG, GMO products, which is anything in a package, antibiotics, poison, prescription drugs, all of these blows holes in the gut. If you have leaky gut, guess what kind of things happen? Asthma, diabetes, lupus. What's lupus? That's muscle aches and joint pain everywhere. Scleroderma, colitis, rheumatoid arthritis, multiple sclerosis, chronic fatigue syndrome. These are all symptoms that could be misdiagnosed as fibromyalgia. Could a leaky gut be misdiagnosed as fibromyalgia? Yes or yes? So why do I start healing the gut first? Okay, in fibromyalgia? Because I want to fix it. I don't want these people as patients for life. I want them fixed. This right here, this causes leaky gut. This is the old vaccine schedule in 1983. This is 2010. However, there are now up to 115 antigens injected into a child. Okay, by the time they're 18. There's about 45 more. There's vaccines for smoking. There's vaccines for obesity, all in the works. So expect to get a huge, and right now, a lot of these are mandatory. We have exemptions now in every state. Okay, but a lot of these are mandatory for workers, which is just horrendous. Since these vaccines are mandatory, since we're getting 81 shots by the time the kid is 6 years old, do you think, and this is what they were talking about on hepatitis B, autoimmune diseases, which is a lot of people are saying that fibromyalgia is an autoimmune disease. They're saying that it is linked to the vaccines, but we don't know why. And do you know why it's not going to be studied? Because it's the most profitable area, one of the most profitable areas of the pharmaceutical industry. I mean, the CDC says, and how they measure the effectiveness of a shot is they measure antibody production. We now know that the presence of antibodies don't denote a protection. You could have a lot of antibodies and get sick. You could have little or no antibodies and not get sick. Okay? So what we used to think about antibodies is not true. What they do know is that if you have greater than 10 antibodies, millimole per, milliliter, if you have this number of antibodies, the CDC labels that as protected. Okay. Well, what they did is they did a couple of studies. In adults, adolescents, and infants, you're talking 9,000, 7,000, 3,000 antibodies. Is that greater than 10? So there's a thing called molecular mimicry. Molecular mimicry means that, see, an antibody only has two jobs. It finds something and kills it, then it commits suicide. So it's aggressive. An antibody is designed to kill something. So if you're supposed to have 10 and you have 9,000 antibodies, these antibodies can attack something else. If they're designed to kill the hepatitis B virus, and there's no hepatitis B virus in you, because kids aren't sexually active or IV drug users, that my kids weren't anyway when they come out. No, they're clean, man. No tracks at all. I checked them. So when you look at them, this molecular mimicry, it's linked to diabetes, rheumatoid arthritis, chronic fatigue syndrome. You've seen this list before, right? Again, it's from the vaccines. Okay, so this is molecular mimicry. So the actual therapies that we're using is going to cause fibromyalgia symptoms. That's why it's at epidemic proportion. Again, fibromyalgia before and after. What's tough about this is, what drug do you get for muscle pain? A pain
killer.
Yeah, pain reliever. What do you get for muscle spasms? A muscle
relaxer.
Okay. Now, what do you get for, let's say inflammation? An
Inflammatory.
Okay, good. Now you got 3 drugs. Are these going to upset your stomach? Okay, good. What do you get? You get an antacid. Okay, good. Okay, now, are you able to sleep at night?
You get a sleeping pill.
Ambien. Okay, good. Okay, now you're taking 5 drugs. Are you happy or sad? Prozac, baby. Okay, now you're taking 6 drugs. You still are bad. Are you happy or sad? No, you're really sad. You're upset. You're sick. You're toxic. Every drug is a violation of biologic law. Is your blood pressure up or down? No problem. Beta blocker, a diuretic will give you a blood pressure drug. Now, since you're taking 7 drugs, and do you think you're going to have tissue damage from these toxic chemicals? Yeah, no problem. We can give you a cholesterol drug because your cholesterol is going to be high. 9 different prescriptions. It took us 30 days to get her off of everything. That's her afterwards. She got her life back. This type of posture. How many people type like this? Okay? That causes demyelination of the nervous system. We can change that if we catch it in time. Demyelination of the nervous system is called multiple sclerosis. This is you, I know. You work with her. Okay? You know forward head posture is going to cause the rounding of the shoulders. That causes demyelination. This patient here, absolutely no curve. But again, fibromyalgia, how many drugs was she taking? Chemical after chemical. This is a restored curve. You're looking at reversal of arthritis. Why do we have a 100% success rate? Because we respect the body and go after the cause. Is she going to have an abnormal muscle biopsy? No. So why are you taking a muscle biopsy? Why are you checking her cerebral spinal fluid? These guys have to start respecting the human body. This right here is a normal human being. This is a human being, not overweight, not with an eating problem. They're eating toxic food products. Okay, because the body is so efficient. If you take in a nutrient and you can't digest it, it's going to store it. The problem is, if you're storing toxic products, it's deadly. Currently, they just increased the amount of radiation in chicken, which means they doubled the amount of radiation in chicken. So if you're trying to eat the white meat, okay, that means that it's loaded with benzene, which is cancer-causing. If you try and eat the commercially available foods, okay, with animal products, loaded with the antibiotics, the bovine growth hormone, everything else, loaded with endotoxins, it's going to cause systemic inflammation. Guess what systemic inflammation causes? Muscle aches and joint
pain.
Oh my gosh! It's so simple. So should we give her a pain reliever or detox her system? Because if you give her a pain reliever, is that a violation of biologic law? Yes or yes? Absolutely. So it's not a diet. It's approaching the patient with respect and awe. This is actually how you could correct fibromyalgia. If man makes it, you don't eat it. You got to heal the gut first. You got to pre-digest the food. This is actual food. Okay, nothing else is food. However, if it's sprayed with a toxic chemical that makes it unappealing to bacteria or funguses, that means it's commercially produced and not organic. It's deadly food. Have you ever heard of pesticide? That means you kill pest. Have you ever heard of homicide? That means you kill a homo sapien. Okay, so the killing part is still there. So if it's strong enough to kill a bug, in higher doses, it will kill who?
Us.
Us. Yes. So it's not good for us. So if you take small amounts of pesticides, such as in commercially produced products, guess what that does to muscle aches, joint pain, everything else? It makes it go where? Up. They don't teach the standard medical doctor how to feed human beings. They don't teach them nutrition. They don't teach that nutrition can make a difference. They don't teach that the nervous system can be solved. So we have new names for diseases. Fibromyalgia is actually toxicity and deficiency. No drug that they give will correct toxicity or deficiency. But then we could do the same thing on everything. Type 2 diabetes. If you read the book Cure for Diabetes, it takes 4 days to get off of medication. It takes 30 days to heal it. We look at high cholesterol. There is no such thing as high cholesterol. There's high tissue damage. You repair the tissue, the cholesterol falls down normally. The body produces 80% of the total overall cholesterol. When we look at this, again, fibromyalgia before and after, you're just seeing 100% success rate with fibromyalgia. Why? Because we're looking for the actual nerve problem. We're looking for the stress. We're looking for the pain. Remember, everybody had an incident of trauma, physical, chemical, or emotional stress. You fix the physical, chemical, and emotional stress and don't try and cover it up with the drugs. I don't care if you've had it for 20 years. We've had patients fly in from Canada, fly over from Florida, fly in from Italy. We just had a patient fly in from Montana. He got 2 adjustments and he was amazed because he slept through the night. We've got a patient that drives 3.5 hours. She's had fibromyalgia over 10 years. Within 1 week, her symptoms were reduced. And she says, I can't believe it. I'm driving 4 hours one way. I couldn't even sit for 4 hours before. I said, look, get an apartment close by. It's easier. Okay. Those little circles, if you're wearing sweatpants, that's a sweatpants. Okay.
Get rid of them.
Got rid of them. Anything that you do, and that's why this chart is so valuable, and this is really, really clear. Give this to any doctor that's trying to cover up fibromyalgia with a drug. If you take something that's toxic to your system, that's against biologic law, that you wouldn't give an antelope. If an antelope has joint pain, would you give it a pain reliever or give it water and fresh grass? Okay, good. If you give it a violation of biologic law, you move closer to death. If you do stuff that's in harmony with biology, you move closer to life. I know, I could have done the whole lecture just right there, couldn't I? I could have saved a lot of time, said, okay, don't do stuff bad, do stuff good. But it really is that simple. People are making it too complicated. They're calling it, this is an ignorant system. You cannot divide the body up into different segments, have these guys not be aware of the entire function of the system. If you know that the blood is brand new every 120 days, the blood is brand new because the kidneys produce the erythropoietin, and they tell the long bones to produce the red blood cells. The spleen looks at every red blood cell, and the ones that aren't utilized, it takes those red blood cells, passes it over to the liver, so the liver breaks it down to the protein constituents to make bile so that you can absorb fats. Okay, so if anybody has a gallbladder issue, do they have a toxic blood issue? Yes or yes? But not in this world. In this world, they just remove the gallbladder and they don't tell you about the fat absorption problem. They don't tell you that it's going to lead to increased cancer rates. In this world, they'll remove an appendix, even though you have a 60% increased risk of colon cancer. They're not going to give you diet and nutrition advice. They're not going to explain, like I am in a couple of weeks, on how to cure Crohn's disease, how to cure IBS, okay, how to cure irritable bowel syndrome, which again is one of the sources of fibromyalgia. This is a sick system that's broken, that doesn't work. Why? Because these guys pass out drugs. Those drugs alter physiology, and that's a violation of biologic law. Fix the physical, chemical, and emotional stress, and your body recovers. Okay, this is literally the cure for fibromyalgia. You've got to get the nervous system checked first. You've got to exercise, but not yet. Exercise should be at the end of this list. First, you got to get them out of pain. How do you get them out of pain? You detox their system, give them healthy nutrition. You allow them to get sufficient rest so the body can heal. The body's designed to be healthy. You give them prayer and meditation. Why? Because if they realize that their bodies are not sick, that their body can heal, you get them to set goals where they're going to run marathons. I can't tell you how many fibromyalgia patients have run marathons because I said, look, I want you to come up with something. I can walk. I walk from the car to here and I'm hurting. I said, what do you want to do? I want to run a marathon. Okay, good. Pick one 6 months from now. Okay, you want to do a marathon? I do a half marathon first, but go ahead. Pick a marathon. And 100% do. You know, what we're offering. Okay, and this is important because this goes out on the net. And what did I charge the gal from Canada who came in? $20. We have a 5-point disease risk assessment. It can't be simpler. Okay, we go in and we not just disease-proof your body because your body's designed to be healthy. We find what your disease risk is. We're not going to solve your pain. We're not going to solve your digestion. We're not going to solve your fibromyalgia. We're going to find out what's healthy in your body and what's not because health is the natural state. Why do we have a 100% success rate curing fibromyalgia? Because we approach the body with respect, that health is the natural state of the body. I mean, I'm going crazy communicating with one of my patients in Australia. She can't find a chiropractor to correct her scoliosis. And if you're watching this, I wish I could go there. Okay, because they're not approaching their body with intelligence. Okay, and I mean, this is how you correct the body. Lori in the back has coupons, and all of these are recorded. Okay, so thank you very much for making it. But look for the solution. Don't look to retreat in the symptoms. Thank you.